And joining us now from her office in our nation's capital, Senator Martha McSally here on Today in AZ. Thanks for taking the time.
Absolutely, Ryan.
So we want to ask you right off the bat, what do you think of Governor Ducey's decision to begin reopening Arizona earlier in the week? And how do you feel he's handled the crisis overall?
Well, I think Governor Ducey's doing a good job. He's being very measured and taking the advice of the experts and balancing the public health challenges so that we can protect the vulnerable, support our frontline healthcare heroes, ensure we have the capacity for treating people who fall ill, while allowing people to safely return to work based on things that we've learned from those who are in essential businesses and how they're conducting themselves and not being hotspots. Just because something is allowed to be open doesn't mean it's going to open, and just because it is open doesn't mean you have to go there if you're not comfortable. So I do trust Arizonans to make good choices as we continue to address this challenge and work through and get through it together.
Do you think that the data represents the ability for us to begin this phased-in opening?
Well, I'm advising the president, and I talked to Governor Ducey about this. We were learning a lot about the virus every single day. And again, we're not going back to exactly how we were behaving 6 months ago. And this isn't an on-off switch. It's more like a dimmer switch. And these best practices that essential businesses and manufacturers have learned by using masks and gloves and disinfecting and washing their hands and staying away from each other, they've learned how to not become hotspots. So these best practices, I think, should be used where they can in other places. And people learning from how they can safely return to work and safely go about their lives. But everyone's in their own circumstance. So if you're vulnerable, if you're elderly, if you just went through chemotherapy, a treatment, your immune system is compromised. My closest friend is a leukemia survivor. She's not going to behave the same way as my other neighbor down the street who's young and healthy. So this is really a balanced approach, and we're all in this together with government guidelines, but then also personal responsibility.
Let's get to the whole coronavirus pandemic on a national level. Do you think that the federal government has done enough to help here?
Well, when we saw how this pandemic was going to be deeply impacting our country economically, we knew we needed to get immediate relief out the door. So we very quickly worked to get resources, cash to families and workers and seniors, and then also support to small businesses who are just the backbone of these jobs, to make sure that they exist when we come out of this crisis and those jobs are there. So we beefed up unemployment. We've got the stimulus checks out there. You know, we've got the PPP program. We were just doing everything we could to get that relief. We don't need people falling into housing and food insecurity because we're asking them not to work. I mean, we're in an unprecedented situation where we had such a strong economy. 6 months ago, the biggest challenge in Arizona was people looking for workers. They had more jobs open than people who were available to work. So now we're in a totally different situation. Up and down my street in my neighborhood, you have families living paycheck to paycheck who no longer have a paycheck. So we wanted to get that immediate relief, to get food on the table as quickly as possible while we work together in a whole of society approach, federal, state, local, the food banks, nonprofits, the faith-based community, neighbors helping neighbors. We are all in this together. We will defeat this virus. We've got to do it together.
And that's certainly one of the major ripple effects of the coronavirus situation. Unemployment, it's hitting Arizona hard. It's hitting the rest of the country hard. Is there a message that you would have for families and individuals who are struggling during all this?
I know there's a lot of fear and uncertainty. We try to get money out as quickly as possible to help you so you can put food on the table, pay your rent. This is a very wide and deep impact. For those who are vulnerable health-wise, there's a lot of fear. For those who are wondering about their future to support their families, it's all understandable. We're all in this together. So look at your circumstances. If you can safely or allowed to return to work, if you're vulnerable in your own situation, or you have someone in your household, everybody's got their own circumstances, but we've got to get through this together smartly. I know Arizonans want to get back to work. We can do it safely in a measured way while also protecting the vulnerable, those in nursing homes, those in hospitals, our healthcare heroes, while we also invest in treatment so we can save lives and not have more people with underlying conditions struggle from this disease. So we're all in this together. Hang in there. As Arizonans, we will get through it together. Reach out for help. to your neighbors, to the nonprofits. There's so much help out there, and we will get through this together.
Senator Martha McSally joining us here on Today in AZ. One thing we love to do here is get our viewers involved. We have a question from one of our viewers. We'd love to ask you if that's all right.
Sure.
This is coming from Wally Lafferty, and he asked, Miss McSally, with our healthcare system in a tailspin, what will you do to ensure that everyone has the healthcare they need, whether for COVID-19 or for cancer or diabetes or anything else?
Well, what we've done for COVID-19 is immediately get support out to our hospitals and our healthcare heroes, over $175 billion to provide to our frontline workers. We've got to support our doctors and nurses. But for everybody out there, they need access to affordable health insurance while ensuring they're protected with pre-existing conditions. I fully support that. I fought for that. We need to make sure it's available and affordable. But there's a lot more that we can do together as we move forward. I've got initiatives to bring down the cost of prescription drugs, initiatives to support small businesses banding together to have more competitive health insurance costs while protecting families with pre-existing conditions. I think this challenge has brought us to a place of unity. Let's work together to ensure that there's affordable, available insurance and guaranteeing support for those with pre-existing conditions.
And if you were to be elected in November, is there something you have on the horizon, a bill you'd like to introduce that would help out with the healthcare situation?
Well, right before the pandemic hit, I did introduce legislation to bring down the cost of prescription drugs. We're going to keep fighting for that while I'm in the Senate right now, because this is a top of mind issue even during this pandemic. As people have lost their paychecks, lost their jobs, they still need to put food on the table and pay for their prescriptions. So this work needs to be done now. I also have initiatives to allow small businesses to work together and compete like a big business, to have affordable insurance. So families don't just have access to insurance where they can't afford the premium or the deductible. It needs to be fitting within their budget and accessible to all Arizonans. So I've already been working on that, and I will continue to as I continue to serve in the Senate.
Okay, I want to ask you, because you're obviously no stranger to airplanes, but earlier this week you did have a chance to fly on Air Force One. Can you give us a little behind the scenes? What is that like with that privilege?
I did. This is an amazing opportunity as a veteran, middle class, grew up in a middle class family. It was a pretty extraordinary thing to be able to travel on Air Force One with the president from DC to Arizona and then back again. I was able to visit with him as well. Congressman Gosar and Congressman Lesko were on board, plus the Secretary of Labor and the National Security Advisor and some other advisors. So it was an extraordinary honor and opportunity. We had some great conversations with him and his team during the trip, preparing to visit Arizona and then on the way home. And just an incredible opportunity. I called my 85-year-old mom from Air Force One. Had the operator, call, like, Mom, make sure you pick up the phone. Just a really cool experience for me. I don't ever want to lose sight of that, given the chance that I've had to serve.
So you and other lawmakers just returned to work on Capitol Hill this week. And amidst the coronavirus epidemic and all that, what has that been like for you? Is it any different now than it was before you left?
It is. I've been working from Arizona, around Arizona for the last 5 weeks. So coming back here, there's not a lot of people here. We have a lot of my staff teleworking. When we are around other people where we are, not aware what everybody's status is, people are wearing masks to the Senate floor. We're having committee hearings, but doing that in a way that keeps people away from each other to the max extent possible. We're essential work is the bottom line. While truck drivers are driving, and those people working in grocery stores and healthcare workers are working, we are essential work as well. So we need to use the best practices from others, but we need to continue to fight and work for the American people. That's our job.
Senator Martha McSally joining us from her office in our nation's capital. We appreciate you spending some time with us this morning.
Absolutely. Everybody be safe. We're going to get through this together.